Depression is one of the most common mental disorders in the U.S. Depression is caused by a combination of genetic, biological, environment, and psychological factors. Depression can happen at any age, but mostly occur during childhood. Depression is a mood disorder that causes a persistent feeling of sadness and a loss of interest. Depression goes by many names, such as the blues, biological depression, and major depression. These feelings is most often accompanied by a sense of hopelessness, a lack of energy, and no pleasure in things. Depression is a mental disorder characterized by depressed mood or loss of interest in daily activities and affect the way you handle your daily activities. Depression is described as a spiritual rather than physical condition, in other words, a mental condition. Depression first appeared in the second millennium BC. Depression can come in many forms and doesn't discriminate against race, age, or ethnicity. Depression can lead to suicidal thoughts and can complicate other medical conditions. There are several different types of depression. These types are major depressive disorder, which is also called clinical depression, persistent depressive disorder, postpartum depression, and premenstrual disorder, and seasonal affective disorder. Major depressive disorder is a sense of hopelessness in which may be difficult to sleep, work, eat, or enjoy daily activities. Major depression can also be genetic, but can also affect people with no family history of the illness. Persistent depression disorder is a long-term form of depression. Although persistent depression is not as severe as major depression, persistent depression may be mild, moderate, or severe depending on the severity of the person. Postpartum depression can trigger from birth of a newborn baby. New moms can experience mood swings such as anxiety, crying spells, and difficult sleeping. A person may experience postpartum depression as early as during pregnancy up to a year after birth. Premenstrual disorder is a temporary form of depression, usually shows up the week before a woman starts their period up until a few days after it begins. The exact cause of premenstrual disorder is unknown, but however, researchers think that it may be an abnormal reaction to hormone changes related to a woman's menstrual period. Seasonal affective disorder is a type of depression that related to changes in season. Seasonal affective disorder usually begins and ends about the same time every year. Symptoms usually start in the fall, in which the term the winter blues comes from, and usually ends in the spring or early summer. Depression signs and symptoms come in many different forms. Most signs and symptoms are unknown and it can be acute. People with depression may experience signs and symptoms such as mood swings, anxiety, apathy, hopelessness, loss of interest, or sadness. Many people can also experience insomnia, excessive sleepiness, early awakeness, or restless sleeps. Excessive hunger, weight gain, loss of appetite, lack of concentration, and social isolation is also considered a sign as well. Although diagnostic tests are rare, the diagnosed depression, however, most doctors will do a physical exam to make sure that the patient depression symptoms aren't related to any conditions such as thyroid disease, vitamin D deficiency, or any other medical problems. The most accurate way in diagnosing depression is to see a mental health profession such as a psychiatrist or a social worker. The patient can speak on things such as daily mood behaviors and lifestyle habits. Once a person is diagnosed with depression, a person will be placed on medications and psychotherapy. There are many types of antidepressants, such as Zoloft and Cymbalta. Psychotherapy is a type of treatment in which a patient talk their related issues, or in other words, this form of treatment is talk therapy. People dealing with depression may believe they will never feel better and that nothing or no one can help them. Left untreated, depression can lead to serious health complications, including death. And seeking help is the first step to conquer depression and to begin feeling like yourself again. There are several paths on the road to recovery from depression. Try to talk to someone who understands what you're going through, such as a counselor or a therapist, or learn how depression is treated.